to invite Dr. Patricia Document.
Hello, well, thank you for having me, Kathleen, in the Center for Latin American Studies in the Office of the Mayor. So I'm very happy to be here. It's incredible, I've been working with Latinos in this area for 14 years. So today I'm going to talk about one of our most recent initiatives and something that's a community-based participatory work. It's called De la Mano con la Salud. It's a network of male lay health advisors, which are called promotores, that work with other Latino men. So that's what I'm going to talk today. So first, this is what I'm going to talk about, and the first thing is the project. So this is a project that is, as I said, participatory. We couldn't do it ourselves. It's based on this Latino Engagement Group for Salud. There's the logo that was made by the son of one of our partners, who's a graphic artist, and Harry Thompson. So, and the partners are community members, and then university researchers as us, and we couldn't do this without the two other organizations that work with us, the School Health Center and the Consumer Health Coalition. So it's a partnership, and I want to acknowledge the people who work there, and also our funders, the National Institute for Nursing Research. This is a research study, and we hope that at some point it stops being research and it becomes current practice. So as part of background, what we did is an assessment. This is before the project. In 2010, an assessment of the health of Latino immigrant men that we are going to call LIM, because our promoters like to call them LIM. So we did focus groups, we did survey interviews with 66 LIM, and also interviews with healthcare providers and social service providers. And we looked at data from less than 5 years here or 5 years or more here. And, well, this is people in the project here. This is what we found. A lot of loneliness and isolation, as Diego very well said. And then there's important to see where does health come from and what do we do with it now when we are sick. So in the first part, we looked at people, Latino men told us that they were lonely. They came here to help their families, left their families behind, had no social supports in this area, didn't know anybody, lived in neighborhoods sometimes that were not so good, and didn't know where to go play soccer, where to go have fun. And well, this was a pretty sad situation. To solve this situation, to feel better, they did two things very frequently. One of them was work more. So they worked 2 jobs, they worked many, many hours a week, and with little rest. Or they had some alcohol. So none of these solutions was very good. But in the survey, we could see that, yeah, there was a lot of alcohol being drank. I don't know if this is more than before, but it's more than what we observed in the Allegheny County Health Survey. And then we also saw that loneliness, this is measured with actual scales, loneliness and social support were pretty low, and were somewhat lower for the people that were here newer. What was very startling is that depression symptoms were so much higher among people who had arrived lately. And these people were really isolated and had not adapted. They were having it very bad. So that was one of the problems we had. Then we have to talk about where does health come from? Because there are issues here. The guys, the LIM we talked to, they told us that health comes from eating healthy, sleeping, resting, socializing in a healthy way, and also exercising. And what happened with their lives is that they worked all day, there was no time for exercising, no time for eating healthy. They were not in a position of knowing where to go to play soccer, where to go to do things, and this made them sick. So now, what happens when they're sick? In the survey we observed that people, you see, people had no health insurance. Usually Latinos here have very low health insurance. These were men that were mostly in construction and restaurants. So they were people, not the whole population of the county, but people who were in need of our help, or the promotores' help. They didn't have a regular source of care. Only 26% and 32 here, about 30% in both groups, went to see the doctor. And almost nobody went to see the dentist, especially those who were new here. Only 7.9% had seen the dentist in the last year. So they had no health care. So what did they do? Well, they didn't know where to go. That was the problem. They delayed care. Sometimes they waited until they could go back to Mexico or to Guatemala for care. That was another thing we heard a lot. And they were afraid of the health services because they didn't speak English, or afraid of being turned to immigration, whether they had documentation or not. Because people who have documentation are also afraid of being yelled at because they may not have documentation. And they were also afraid of payments, los biles, of the bills. They call them los biles. So that was bad. They tried to make do with their social connections, but those connections were very few. For example, one man told us that he knew somebody at the Burlington store that had befriended, and this person gave him advice on where to go when he was sick. That's a very strange kind of connection. But, well, some people asked their neighbors. This with the Burlington store was very peculiar. So those were the things. And how do we put this into context? This is how we think about it. And I will go through these things. People live in their families in a more or less collective fashion. They have certain status in the community and the normal support, and there is stability. But when there is poverty, there is instability. And that's usually what prompts migration to the United States, to help their family. Once they get to the United States, they are made illegal aliens. That's the name that the system gives them, because people, as I learned from Sister Janice, are not illegal. Illegal is the status. So people may be undocumented. They have low social status. They are considered people that are undesirable, and low social support. Usually, and they are here for the family. They are here for helping their family. But because of all this situation, people derive their social identity from the identity of the group in a great part. And for them, that's a bad identity. So they start feeling bad. They also worry about their families, and as we said, are lonely and disconnected. And that brings about disaster. So they have stress, not information, were accidents, they are called, the extra work, eventually they have depressions. So this is the situation that the men we work with are confronting according to what they told us and according to what we read in the literature. So we created an intervention for this. As I said, it was a community-based participatory work. So it was not myself. Together with men in the community and with other organizations, we created an intervention, and this intervention was a network of promotores. Promotores are legal advisors, are people from the community that are trained to help people in their own community. They serve as bridges between the health services and the social services and the population. So they connect. That's their main reason to be. So what our promotores do is do connections, of course, to the community, to the services, and to the health system. They also listen to the participants. The promotores have been trained to listen to the participants in a non-judgmental manner. Sometimes the limb, all they want is that somebody listens to them. There is nobody to talk. Somebody listens attentively and acknowledges that, yes, what you're telling me rings true. So that was also very important, and provide guidance on health topics and other topics that sometimes we didn't expect. So this is how our promotores network is organized. We have a super promotor, who's the guy who is the main promoter. He is the one that knows better how to outreach to the community. Right now, he is Miguel Gonzalez. And then we have other promotores who are men in the community. So these promotores work with the super promoter, and then each promoter has a series of clients who are other men in the community. When a promoter meets a client, so he can connect him to other services. For example, where to play soccer, medical services, English classes, lots of English classes there. Churches. We have a list of churches that include mosques. So we have all sorts of mosques, not the church, or religious services. So what did we expect? Remember the drawing that I had before, a little complicated. So we expected to affect the social support, to have more social support for these men and to improve their isolation. And hopefully, this would happen and the things that are becoming greener would be affected. And we will have an improvement in their health. We're not there yet. We don't have all those data. We have preliminary results. We finished enrolling people in this project in the beginning of September. So we have almost all of the baseline data, but we don't have the results. We do have what people have been telling us from the results, but we cannot present results yet. So we initially hired and trained 11 promotores, 11 men as promotores, and we have had, this was a 20-hour training, and every month we have a training on a topic that the promotores choose. We decided that the best thing is that they were going to know what was necessary at this point, so they decided what they needed. And then we have not, right now, with nutrition and everything, we started in November of last year, we have 7 promotores that are terrific. We meet every 2 weeks on Sundays for our project meetings, and that's the time that's possible for everybody. And it's not the best time for most of us, but some people cannot do it another time. So, and it's very invigorating because it's fun. So that we have 7 current promotores. And this is the time when we were training them. Our promotores currently are from several countries. We have 2 from Mexico, 2 from Guatemala, 2 from Venezuela. This is too many. One from Venezuela, sorry. 1 from Puerto Rico and 1 from Colombia. So we have 7 right now that are being active. And this is the training at the University of Pittsburgh. So what has happened with the outreach? The promotores have gone out. Some of them got clients for the network from their acquaintances, people they knew from work, their family members who had problems, and some others went and outreached in stores, in diverse places in the community, churches, and they stood there and did outreach. We went to fairs, to La Feria, of course. We went to different places, and they have enrolled 177 clients, which is tremendous because the funding source said you won't be able to enroll 100. So they follow up every 1 to 4 weeks with the men, and they have these promotores meetings on Sundays that I had described. So these are pictures of the outreach. There we have an outreach at a store in Brookline. Somebody is filling out a consent form on top of the garbage can. That's not so healthy, but that happened. This is at La Feria of last year, and that top one is at the Latin American Caribbean Folk Festival this year. They were young people connecting with their cell phones. They were exchanging digital information somehow there. So this is the client profile. They have been in the United States, roughly almost half of them, less than 5 years, and a little bit more than half that have been here more than 5 years. The age is pretty well distributed. We have all ages. Well, not that many 45 years and older, but we have a fair distribution of ages. The origin of our clients is interesting. Most of them are from Mexico. You see, it's almost 60%. And then from Central America. So that's the origin. We only have 3 people from South America and 1 from Cuba, and the ones we have tabulated right now. And that's kind of where the need is. The people who have most of the need, probably. Also, we know we are reaching people that have the most need, because we know that we have here almost 46% of people who have not finished high school. So these are not people who are in the universities. These are people who are working. The majority work as construction workers, I don't have that data on screen, or work as restaurant workers, for example, in services. Working with the clients. This is an interesting picture because there are no clients there. Our department thought that our work was the one that is behavioral and community health sciences. this identified the work of the department. So they wanted it to put it in a brochure. And they said, we want to shoot a picture of the promotores. And I said, great, come to the store when we are outreaching. And they said, no, it has to be in the building because the photographer has no time. But the building, well, and also we couldn't shoot a client because we didn't have, well, permission. This is a research study, we cannot be shooting research participants.
We hope you're not
shooting pictures of, it's a translation issue. So we could not be shooting pictures of research participants. So luckily that day, 5 of our promotores, one of whom is here, could come, and 4 of them posed as clients. We converted the place into a dining room, put cookies and things, and the one, Luisa is the one that's talking to the others. And he was in that position for a long time. I took like 150 pictures and smiled more to the right, more to the left, look at the other man. Well, but it was an interesting, that's more or less what the promotores do, only this was staged. Just disclosing that. So, what has happened? What have they offered? They have offered a lot of assistance with medical health, appointments at the School Health Center. Now lots of the men go there, and it has become easier, even though we have problems with no shows. Some people who don't come when they said they would come, we're trying to get on them. And many men are now trusting the services. And there are bilingual staff and bilingual physicians there that can see them. Also, they have a dental clinic, and we have had, since there was such a dental need, we have lots of people who need dental care. Sometimes they call the promoter and say, I have this thing, this problem with my mouth. I can't sleep, I can talk, I can nothing. So dental care is very important. And in those cases, we don't start with usually what's your life, what are your problems like, we solve the main issue with the dental care. And then after that, we go into, well, I don't, the promotores go into helping them in other things, because usually that is just the tip of the iceberg, what's bothering them at the time, but there are other issues, either with relationships or with work and other stuff. Also, what to do with the bills, or los biles, like the guys call them. So it's not that we pay the bills, but we help them identify help when that's possible, or sometimes if you can call some types of services, you can, the collection agencies, for example, when the bill becomes pink, so the collection agencies, they can let you pay parts, the billing parts. So that's something that also, since our promoters are bilingual, they can work with the clients and the collection agencies. Also, they connect them and refer them to many places, so we have been sending them to lots of places. And sometimes they have a sister that needs to go somewhere, so we refer that person, or a child that we can refer to Dr. Diego, for example. So we have people that, some people are not alone here, some people have families and need to be referred. Also, work issues. This is something that we didn't expect to see that much, but many people want jobs. Well, in this economy, everybody wants jobs, right? So many people want jobs, and our super promotor is very good at getting the word of the jobs that exist and distributing them among the promoters. Other job issues that we see is that sometimes the boss says, you go and I'm not going to pay you the last week because, no, you didn't work well, but he was there, so he's not being paid. And that's a problem we see, and we have been working on that. We also have housing issues. Sometimes there are bed bugs, and the owner, the landlord says, well, heck, I'm not going to do anything about that. That's your problem. And that's not his problem. Or something breaks, the fridge breaks, stops working, and the landlord says, well, I'm not going to fix that, and that's not right. Some people don't have heating, and so there's a lot of that. And as they said, there's a lot of rights that we don't know. And if we don't know our rights, we cannot claim them. If we don't know English, we cannot claim them well because we don't say things clearly. So those are things that happen that are not well, but we're trying to help people with that. And immigration issues. This is where we cannot do anything. But some people look for us because of immigration issues. We can tell them what's best for them. In some cases, we have right now a client that had a DUI and he was going to some education classes because of that with his promotor. Eventually, one day, apparently, the police showed up and took his house. He opened the door, and it was not the police, it was ICE, Immigration and Customs Enforcement, and took him. So then he landed in the Allegheny County Jail, where he's been for over 2 weeks. And we learned at the past training this Sunday, right, that's not appropriate to hold a person for that long without a criminal charge. I had no idea of that. Boris, the promoter, didn't know, but the lawyer, that's been solved. But there was a problem there, knowing our rights. So since immigration is not our main thing, or law is not our main thing, but that does affect your mental and social health. We also had another person who did have a health problem. He was in an abusive domestic situation where there was another man who wanted to extract his money. He did extract his money, and when he didn't want to give it up, he would beat him and with the belt, the chair, and the microwave, for example, that ended in some broken ribs. That person actually was undocumented, but is being allowed to stay for now because there is a criminal proceeding against the aggressor. And we ended up going to court because he needed support, and also the promoter needed support. So we had a variety of things that have not been what we originally thought of as health. But anyway, those were the things that we were doing. Those extreme things are not the things that happen every day. Things that happen every day are tools, I don't have care, and of course, I don't have a job, which is what's most frequent. So we don't have data yet. We are going to have it soon. We're going to start getting the data on the follow-ups, the depression, the loneliness. How is that going, if this has had an effect? We do have some things our promotores tell us. Miguel told us the other day that he has a client that was drinking a lot. So the plan, the Éxito, the success plan that they did in the beginning, with all the clients, was drink less. So instead of drinking 5 times a week, just drinking 2 times a week, okay? So drinking a lot, I mean. So that has been, he has been working on this plan and has improved, and that he had, the client said he had the plan by his bed, the bedside. So when he thought of this drinking, he looked at the plan and said, no, I'm not going to drink that much. So he's still drinking, but less. So whatever works, that seems to me like a success. And there are other cases that have been successful as well. So we also had fun. So these are guys playing soccer. It's a tournament they organized. It's not part of the project, but it's kind of comes because of the project. They get together, and some of the promoters have been helping them get that together. We donated the trophies. And that's a picnic we had in Shenley Park when some of our promotores and clients and some of them brought their families. So we were all having fun and playing with water balloons, getting wet. So as far as the future, what's going to happen once we have all the data, I think we have demonstrated there is a need that's unmet, and we have trained promotores. There are results. Still, we need the harder results with the data on depression and isolation. But now, what do we do? So, of course, I can apply for more research funding. Actually, I think I would, so that we compare this with something else and we have stronger evidence. But I think we have pretty good evidence of some things that some things are working. So we would like to partner with other organizations, with government or non-profits, to find a viable solution to have the promotores working. Our promotores are men from the community, as I said, and they work. They all hold jobs. And they just moonlight 10 hours a week as promotores, which is a lot of effort that they are doing. We do pay them for this work. And it's not much money for all what they do. So partnering with an organization would be ideal if this could be a service thing. So, and finally, I wanted to show you, these are the guys who do all the work here. Miguel González, who's our lead promoter there, Boris Tesac, Ángel Miranda, Leobardo Polanco, Herminio Ramírez, Luis Alquila, y Jorge Delgado, who's actually present here. So, and that's all I have to say. Thank you very much.